Hey everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well, and welcome back to another case of hard as nails earwax. Now, this one was especially difficult, not because it's technically difficult or technically challenging, but because it's very, very painful for the patient. And if you make it to the end of the video, you will see an incredibly heavily inflamed ear canal and eardrum. So it really looks horribly infected, but it's not. It's just that what's happened here is you can see that the debris is quite fibrous, and that's because this patient, for some reason, has packed their ear very tightly with cotton wool. I think because they've applied lots of ear drops to get rid of the earwax, but they've shoved cotton wool right down and smack bang against the eardrum, and lots of it. And what's happened is this sort of bizarre plug has formed whereby, the wax and the cotton wool has just sort of melded into one, probably with the addition of further drops, almost like sand to cement. So it's become super hard and it's adhered to the ear canal walls. And, probably what I could do is shove the hook in and just kind of rip it out. But this patient is already very much sort of, see right there where the camera kind of wiggled around, that's because the patient is flinching and she's kind of gritting her teeth, and she wants it out because she's been turned away from not just other clinics but also urgent care. So she's been turned away, so this really is last chance saloon to get this wretched thing out. But I could rip it out, but then she'd hit this, she'd probably jump through the ceiling, and I'm really not that keen to cause any bleeding at all. So what I want to do is just take my time with this and just ease it out as best I can. Applied, see, and again, and that when you see the camera jitter like that, that's because the patient has jumped or flinched, something like that, which is why it's so important to brace with your hands at all times. So so any audiologist watching, you'll know that's a technique that we often teach when we're training students. So again, olive oil in here, not really to do anything per se. I just thought it might lubricate the canal a little bit. That's not really happening. Going in with suction again, I thought I'd be really clever and try and loosen up this section down here, but it's just plastered on big time. There is a little bit of movement there, as you can see, but again, there's no way that suction is ever going to work here. So I thought I'd just try and bring in the sides a little bit. So usually when it's kind of plastered like this, you can use the parcel technique, where basically you kind of take the debris in from the sides, like you strip away at the edges in an attempt to try and sort of unstick it and unadhere it, but that's clearly not working. And just trying to grab onto the main plug here, just to try and kind of wiggle it around, but this is just not happening. So I think it probably, at this point, I knew that the suction wasn't working, but I was just sort of, I think at this point, trying to figure out what to do here. And of course, really, the answer is obvious. I'm going to go back to the hook. But a very, very dense plug here. And the reason behind the sort of, inflamed look, which you'll see at the end of the video, is, I'm going to switch back to a hook any moment, I think. The reason behind the pain and the inflammation and stuff like that is not because it's infected, but because, again, there's pressure. There's horrible, horrible pressure pressing on the skin of the ear canal and on the eardrum, and that's causing an inflammatory response. So typically when you have, damage from pressure, so damage to tissue from pressure, you'll get a release of things called prostaglandins in your body. And prostaglandins are sort of an inflammatory mediator, which means that prostaglandins are chemicals which will make your body respond to damage. So that's vasodilation, which is like widening of blood vessels to give a redness. You'll have heat, pain, swelling, and so on and so forth. And that's how ibuprofen works. So ibuprofen is a painkiller, and it's an anti-inflammatory. And if you take ibuprofen, it will block the production of prostaglandins. So that's why it reduces the pain in your body. So bringing this out, it is a gigantic plug. Now, unfortunately, it looks as though I get it in one, but actually the back portion of it breaks off. So I suppose the olive oil has helped a little bit in the sense that I can kind of, slide it out without too much trouble. but it is just a gigantic, you know, boulder of cotton wool and earwax. I think probably the patient had a bit of a blockage and they were encouraged to use oil and then plug the ear with cotton wool to keep the oil in, possibly. You can just see the eardrum back there. It does look a mess. This is the back portion of the plug. And I think this is the portion that's been pressing on everything. So you can just see in the background, it does look like a bloody mess, but there is no active bleeding. It's just all, you know, it's called erythema. So erythros is Latin, or Greek, I think, for redness. So erythema is like redness of tissue, dilation of blood vessels. So moving out there. Now it looks, at the time I thought, oh, is that little perforation up at the top, but it's not. It's, and we tested that with a tympanogram. So bringing out this last piece with the hook, and it's so hard that it's actually very difficult to actually get, you know, dig the hook into the debris. So there we go. And the reason it looks sort of dark or blackish is not because there's dried blood in the mix. It's just very old debris. It's very old oxidized earwax. Moving in, so a very, I mean, you don't need to be trained in healthcare or medicine to understand that that looks like a very, very, very sore ear. And you can see all the capillaries of the eardrum are heavily, heavily dilated. So, and it's just towards the top, the handle of the malleus, it looks perfect, but it's not. See the eardrum flexing, almost breathing like that? That's because I'm getting the patient to do a Valsalva maneuver, which is where they're pinching their nose and then trying to blow through their nose, like you're trying to pop your ear. So again, these are the two pieces of debris. Very, very difficult case, but you know, good at the end because the patient felt a million times better after it was removed. And I checked up on the patient a few days later, and of course there's no symptoms, you know, so there was no infection. So there we go. Hope you found that one interesting. If you have any questions, leave them down in the comments section below. I will try my very best to get back to you. And of course, I will see you guys on the next video.